Hello and welcome to this episode of Goa 365's Face to Face. Now, everybody has been talking about the expected, imminent, depending on the adjectives, third wave. However, in many cases, in many places like Goa itself, it doesn't look like the second wave itself is over, though there are declining cases. But the center has been warning that we should maintain a lot of protocols, spaces, masks, vaccinations, and the cases have been rising all over India for the past 2-3 days. So with us is Dr. Lenny Da Costa. He's based in South Goa and he has a clinic in this also. He has been treating COVID cases. He's been talking about it on social media. He's been talking about the various aspects. So Dr. Lenny, welcome to our show.
Thank you. Pleasure to be here.
Doctor, could you give us a general briefing on what exactly is the status now as with COVID, and then maybe we can go on like what is this, explain to us what is this third wave. Everybody is talking about, the center has been sending directives, the people have been talking, it's coming, it's not coming, imminent, it's starting October. So for the lay people, for our audience, could you give us a general briefing, Doctor?
Okay, so the world over, we've been having these waves of infection. It is not, we've been classifying it as first wave, second wave, in whatever, depending on how we have been able to see it happen in our own communities. But for example, Japan has spoken of some fifth or sixth wave in some cities. So what are these waves? You need to understand what these waves are. Generally, what happens is the virus attacks you. And then it starts attacking a large number of population together. And when that happens, you generally have a big number of people who may be sick and may require hospital attention because they don't get their treatments on time. That is what happened in the second wave. What was basically happening in the second wave was the virus acted a little different from the first wave. In the second wave, people didn't know that they were having infections, and by the fifth day, they would get very serious. And so there was a huge load on the hospitals. Unlike in the first wave, where the same cytokine storm would appear somewhere on the 8th or the 10th day. So this was a kind of a difference between the two. Unfortunately, somewhere the doctors or the medical fraternity has not been able to get together and say this is how we are going to treat it. There have been recommendations coming from the ICMR, from the WHO, which have changed. What we had in June of last year is totally different as to what we have today. Today we have absolutely nothing to treat COVID with. You understand? So when a patient comes in, at least we had something earlier. Now as per WHO and ICMR, nothing works. And so we're not supposed to treat it anyway. In fact, there is a study on remdesivir that has come out which says that it actually prolongs your stay in the hospital. So what do you believe and what do you do? So the medical profession on its own should have been vocal about what works and what doesn't work. But they have taken the backseat and allowed some bureaucrats in the WHO or the ICMR to decide what has to be decided, what has to be done. Unfortunately, in the private sector, we for some reason do follow our gut instinct and give patients treatments, and some of them don't end up in the hospital. So that will keep happening as we go along. Now, what is to be expected as far as the third wave is concerned? One thing that we need to understand is many of us are vaccinated. When the vaccinations have been given to you, it doesn't mean that you are totally off or you're not going to get the virus. The chances are that you will get a mild infection, you might not even know about it. But the chances that you will spread it to somebody who has not really gotten vaccine is also pretty high. So that is the reason why you need to be a little more prudent and say, hey, listen, I need to take care of myself. I don't need to go into crowded places. I need to keep that distance and ensure that I don't get sick. And if I do get sick, get to the doctor at the earliest. Don't wait to see what is happening. See, we generally, the one thing that each of us as lay people, as ordinary citizens can do is don't treat this like you would treat a common cold. See, when we have a common cold, we stay at home, take an aspirin, take a crocin, and we are fine. Don't do that. If you do get a cold, if you do have a problem, if you do have fever, if you have any kind of, get to the doctor. Let the doctor decide what he wants to do. Don't self-medicate, because that is the problem that happened in the second wave. If you take these measures, the chances of a third wave might be non-existent, because we will keep getting infections. But Whether it will affect us like it affected in the second wave is depends on how we respond to that infection.
Doctor,
So all of us,
let me just interrupt on this. Now, a lot of besides the vaccination, a lot of people have got infected also. So what about? So does this also, like a vaccination, does the a person who has been infected also, does he also get that same sort of immunity or this?
so there are a couple of studies or a couple of papers that have come out. You see, the first person to get infected after he had already got COVID was a patient who was infected in Wuhan itself in
Hmm.
April 2020.
Hmm.
He was diagnosed as having got a reinfection when he was entering China again because he had gone out for some work in
Okay.
September of 2020. And on his way back, he was discovered while doing an RT-PCR test at the
Okay.
airport. Now, when that happened, he was kept in isolation for a month to see what happens. He developed no symptoms. Similarly, whatever other, even in India, whatever reinfection, second, third infection that has happened in people who were already infected first, showed they were all asymptomatic. That means what can happen in people who are already, and there is a paper to this extent, to kind of explain why this happens, is that they say in that paper that the chances of you having good immunity lifelong post an infection is very high because the bone marrow itself has a memory, and that memory creates fresh antibodies every time you get a fresh infection. So that kind of explains why people who are reinfected don't really get a serious disease. They don't even get symptoms sometimes. So that is what we have seen, and that is what has been documented. I mean, of course, there are people who say, I had a second time COVID and I had these symptoms. There are people who say that, but nothing has been documented. I'm talking about what's documented. Now, what basically happens is these people can be carriers because you don't know that you have it unless you go and test yourself. And so they can be carriers and they can spread it out to others because the virus will be in the air. It will come on its own waves whenever it is there. So if many people have got it, if there is a kind of a herd immunity that we were expecting, which is not happening, even despite the vaccine, you will still have mild infections all over, and these mild infections can create more infections, leading to a kind of a wave that we had in the second wave. Now, there is also a lot of thing being made about children. There are studies that were done very early in Wuhan, which showed that children below 12 were not getting seriously infected. They may have got the virus infection, but they didn't have any symptoms. There were reasons given for that because of their high melatonin content and etc. 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 Let's not get into those technicalities. But they can have. They also said that children from 12 to 18 can get infected. So that is what they are expecting now. That may happen. We have to wait and see whether it will happen because you can't predict what is going to happen in the future. I think we need to be kind of ready for everything.
But this between to 7 to 12 and between below 12, why? What is the reason why they are expecting this 7 to, I'm sorry, from 12 to 18? And
So
that's why
what
everybody
happens?
is trying for a new vaccine and
Yeah.
lot of research is going on.
What is
Why?
what
Why?
what they have kind of understood is why is it that children below 12
Hmm.
don't get bad COVID infection in the sense they don't get infected badly. They say that because of high melatonin that is present in your childhood and in the third trimester of pregnancy and afterwards. That is what some papers say.
Hmm.
Uh, that melatonin levels in your body, general normally, starts going down after the age of
Dropping.
12,
Okay, okay, okay.
and they reach the adult levels around 2021. So between 12 and 18, as your melatonin levels go down, you may be susceptible to infections that the adults get. That is what is the thinking at the moment.
What are the precautions that kids from say 12 to 18 should take, or the parents of the kids? So the general precautions that one can
So
take,
general precautions
immunity
is
boosters, X, Y, Z,
no,
whatever.
no, so these kids have enough immunity. You don't have to look for immunity boosters. What you need to
Okay.
look at is you need to get to a doctor when you have any symptoms that show that you're not well. You could have a headache, you could have a mild cold. Don't wait for it to get bad. Go to the doctor right at the beginning. Get yourself tested very early. That is the precaution that you need to take because COVID, when you test early and intervene early, is treatable very easily. It is when it gets a little serious when the cytokine storm sets in. And so that is where you don't want to reach that level. So there are two different phases of the disease. You need to treat it in the first phase, and therefore reach your doctor early. That way you will prevent going to the hospital.
Now, early means what? The minute you get the symptoms, the first day, second day, what?
Exactly, because your symptoms would be about 24 hours or 48 hours after you got infected.
Okay.
So if you further wait to see if your home medications are going to work, it's going to take another 2 days, and by the fifth day your cytokine storm might set in, and that's when you need to land up in the hospital. That's the reason why I say the moment you see symptoms, go and see a doctor.
Now, the last time in the second wave, we were really hit very badly when a lot of lung issues and people gasping for breath, oxygen. What exactly happened? Where did we basically? You feel where did we go wrong? Where did the I don't know, infrastructure, administration, or even the medical profession or the people? Because I want to get to the people's behavior a little later. But why did it really take such a drastic turn?
So Glenn, what basically happens is, for me, I come also from the same medical establishment that we have in Goa, and I'll tell you, as far as it is compared to the rest of the country, we actually have a very good setup in Goa, extremely great setup, right? Now, unfortunately, this setup is not meant for the load that came in at that one time when that second wave happened. There were too many people who needed hospitalization. No public health system is built to take that kind of a load. It is to take. I mean, if you look at the hospitals now, they're practically empty. You don't have that many people in COVID hospitals at all. So, were we underprepared? No, we were prepared. We had it, but we didn't expect such a massive kind of onslaught of people who needed immediate service and needed oxygen. Having said that, yes, maybe some part of the infrastructure, as far as that oxygen was concerned, maybe that could have been better organized and better used and better maintained, or you could have had better facilities there. Yes, that could have been said. But other than that, we actually had good enough facilities to take care of it if it was not for that huge surge in infections that took place suddenly. Now, the surge in infections took place because of one other thing, because the virus behaved differently. See, the virus in the first wave, when it happened in June to September, what it was doing was people would reach the hospital on the 7th, 8th, 9th, and 10th day of the infection.
Okay.
Here, what was happening is you don't even know that you've got COVID, and you are already landing up in the hospital. Why? Because on the first day you would have got infected. You might have got some mild fever on the second day. You ignored it, thinking that it is just some flu or some cold. Third day, you decide, okay, it's not going off. If you want to do an RT-PCR, because of the load of RT-PCR, you were getting the RT-PCR report on the 3 days later, which was effectively the 6th day since your infection. By the 5th day, you had to land up in the hospital because you were already seriously infected with lungs. Because what happens, the cytokine storm hits your lungs, hits your rest of the body. That is an abnormal immune reaction. Your own immune system abnormally and overreacting. So it kind of overreacts, and that is what causes the lung damage and the other organ damage. And that's why people die in COVID. So that used to happen on the 5th day instead of the 10th day, which was happening in the first phase. So the virus kind of behaved differently in the second wave. And that is the reason why we had such a huge surge of people who wanted hospitalization. If they were probably okay 2 days earlier, suddenly they would end up in the hospital 2 days later. The whole system did withstand that onslaught, but at times it looked like it was crumbling. If it had actually crumbled, we would have had a lot more deaths. I mean, hats off to all the doctors who are working in these COVID care hospitals, which did a fantastic job despite the fact they were overloaded and they were overworked. They did a fantastic job. If it was not for them, the whole system would have crumbled.
Now, in the third wave, what are we expecting? Are we expecting something like the first wave, or we are expecting something like the second wave, or what? What exactly?
So we really don't know, because I've been reading reports over the last 2 days of various cities in the US where the population and even in Israel, where huge populations who have already been vaccinated are also getting infected, and they tend to carry the vaccine, the virus to others because they get mild infections most of the times. So we don't know whether it's the Delta plus that they're talking of, or it could be some other mutation that might come in. We don't know because the virus will keep mutating depending on how you are trying to fight it. That is the law of nature, and every virus does that. Especially coronaviruses, the entire family has been doing it. We still don't have a fixed vaccine for our influenza virus. Why? Because every season they change, and so every season you have a new seasonal flu virus. Right? That is the reason why you can never get uh, whether we have the right vaccine to kind of push
100%. 100% vaccine.
get this, because the virus will keep mutating, and therefore you will keep having this, and therefore I think we now need to sit down and understand what is going to be our response to this kind of, of, of reality, because we don't seem to accept this reality that this is what is going to be the way forward. You need to understand what do you want to do if something like this happens. Are you going to keep the entire business locked down all the time? You can't do that. That is the reason why I say it's time now for both the medical fraternity, both in the government sector, private sector, to come out with some sort of a way forward and help the community to move forward, to move beyond this. We cannot do businesses with such curbs coming on. You don't know what's going to happen in 2-3 months. You can't possibly do the kind of business. The small businesses were suffering because of this.
Suffering, they're dead. Most of them are dead. Suffering is an understatement.
Recently, the entire the tourism industry wanted to know what to do. Despite all their things, they are not allowed to actually go full-fledged out. Though they are all open now, it's going to be tough for people to do this kind of to go back to what they were doing earlier, unless we have a good strategy. And unfortunately, that strategy somehow has kind of not been formed, or it has been not been able to, we can't kind of strategize extremely well to fight this virus.
Yeah, okay. Yeah, okay. I get what you're saying. Now, I don't know. I feel that the only strategy that the government is doing is vaccination. Even then, we've not been able to vaccinate that many people. See, is it just one dose of the vaccine? Is it going to have any effect on you? Or you need 2 doses plus that for 15-20 days gap? What is it? Is it not important? Second dose plus to this?
So the reason for extending that second dose, I'm not in a position to understand why, because it's the same vaccine across the world. It is given in 4 weeks or 6 weeks, 4 to 6 weeks, right? Which I'm talking about Covishield, which is being given in India.
And Covaxin is 28 days. That is fixed.
So Covaxin is excellently given 28 days, and that runs. But Covishield, they've extended the time of the second dose. Now, across the globe, they have a fixed time that they give. Within those
4 to 6 weeks,
4 to 6 weeks. Now, what basically happens is, you need to understand that when you give any vaccine, your lung immunity is low. So the first 15 days to 20 days after the vaccine, you should actually isolate yourself and not get into contact with anybody, so that you may not get the disease. So look at people who have the so-called breakthrough. It's always in this first 15 to 20 days, both of the first dose and of the second dose. So after both doses, you should actually take 2 weeks off and stay at home. All right. That is one way to get the best out of the vaccine. You're taking the vaccine, you should be able to get the best out of it, not get hit. Right? So that is one thing that happens with all vaccines. Okay. Now, the major reason why people want to take vaccines is because they want to travel freely. And unfortunately, even with Covishield, which is thought to be, you should be able to travel across the world, it is only allowed for some 13 or 14 European countries. WHO has still not put it on the list of accepted vaccines. We are hoping COVID vaccine will be done by the end of this month. That is what they are expecting. So with that in mind, people who want to take vaccines and who are thinking of traveling, they need to have that vaccine taken. So you need to do it. For the others, yes, you need to do vaccines that are available. Get both your doses as far as possible. If Covaxin is available, use Covaxin. If Covishield is available, get Covishield. But get both your doses done as fast as possible. I think that is the only advice that we can give people who want to take their vaccines and be safe.
But
are you safe? We don't know. But yes, we're hoping that you are safe.
that nobody knows. You get out of your house, you can be hit by a car, but that's okay. But the chances, basically, what you're trying to say, that the chances are better if you, besides precautions, you also have the vaccine. That's what you're saying, no? Especially
Exactly.
for business. Yeah.
Exactly. If you want your business to get back on track, I think most people should get vaccinated. Uh, which
I
vaccine you can always decide which one suits you best. Uh, we have got Covaxin available in Goa. We've got Covishield available in Goa. Hopefully, we'll get others available because Sputnik has come in, and I believe today there is some new one that
Johnson and Johnson single dose.
also has come in. So yes, there are. See, each one has their own side effects. They have been widely reported. I'm not going to get into it. And I'll tell you, every doctor will also advise you what are the steps that you need to take to prevent those side effects from happening, and those are also available. So if you do it properly, and if you understand what you're doing properly, yes, you should go and get your vaccine done. If you have had already the disease
Vaccination.
in the last within the
Okay.
last 6 months, you wait for 6 months and then do it. Let people who have not had it get a chance to get it done first if there's too much of a problem.
Now, one thing I like to go back to something that you spoke about, business. See, ultimately, what happens in business, from what we've seen, what we know, it is confidence of the people. Just because business is open, doesn't mean people are going to come. Will be few people coming, not coming, whatever. Like you see in Goa, a lot of tourists are coming in, but they are not. Either they are going to the 5 stars, or they are literally, which is not going to help business. There are almost, I don't know, huge number, if you're talking about the tourism, huge numbers are of hotels, restaurants are closed, maybe almost 3/4. The 5 stars are doing well, they've dropped the rate, so the 3 stars are dying, restaurants are okay. So that confidence building is, don't you think that is the most important thing that has to come if business has to, if business has to, revive, because if not, people will be out on the streets, literally. Nobody knows when this corona is going to get over, or if is it ever going to get over.
No,
Maybe, probably.
so that is what I was just saying. See, this we need to understand that this virus is going to live with us for some time now, and it's going to be a way of life. And so when you understand that first, now you need to strategize about how you're going to go about ensuring that people have good health despite the virus existing, and they can do what they need to do on a regular basis, do their business, etc., 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 with confidence, so that there is no problem or no fear or fear psychosis of this virus. Right? For that, I believe we need to start thinking in that direction as to what we're doing. We are not. We are at the moment, at the government level, even at our own in the community, the medical community level, we are only looking at how we are going to be able to treat when it happens.
Correct.
What if we can go a step further and say, hey, listen, this is going to happen. We have these measures that are set in. Now let's be open about it and say, these are the steps that you need to take and get down to doing your business the way you have to. This is the new normal. Do it this way. Let's do something. We are in a limbo at this point in time. We don't want XYZ started because there's going to be crowding. Crowding in India is going to happen.
It's
Are you
impossible
avoiding
to
it?
stop.
See, the other day I took a flight. You make me sit with one seat apart in the airport, but in the flight you have a person sitting right next to me. I mean, how stupid can we be? For the sake of doing things, we do things. You need to be a little more straightforward and understand that in India crowding is going to happen. How do you go beyond that? Every business, if it has to survive, I mean, if you're going to stand at your neighborhood
Grocery store.
grocery store, you're going to have people around you. Are you going to say, no, I'm going to close my grocery store because there are people? At the pharmacy, this happens. It happened at the height of COVID, where people were still crowding. You cannot avoid it. So you need to figure out a way that, and you cannot use that as an excuse to close down businesses. I don't think that is right. I think if we doctors turn around and say, hey, listen, you need to stay at home, we are not doing our job as well. We have to figure out a way as to how we can fight this virus. It's easy to run away from the battle and stay at home. It's far difficult to go out and fight the war. And in war, you need to use every strategy possible to fight it. And this is war against that ethical set. So you need to look at it that way.
Thanks, Lenny. That was it's ultimately that is the reality, and you've put the reality, I think, very clearly in front of us. Ultimately, this is going to stay. Somehow or the other, we have to come to terms with it and figure out what to do and move forward. Otherwise, it's going to be big problem. Yeah, Lenny, thanks a lot for coming on our show. Thank you.
Thank you for having me. It was a pleasure.
And keep watching Goa 365.